Welcome back. Joining me now with a commitment to treating his patient's pain without surgery or medication is Dr. Christian Miliotto from our sponsors at Western New York Pain Relief. Hi, Dr. Miliotto. Thanks for coming in.
Pleasure as always.
Okay, we know that you treat a wide range of injuries and ailments, but can you tell us about nerve and joint pain specifically and how it affects people over time?
Yeah, so understanding the body is really important. As we get older, we start to have natural degeneration, but some people aren't affected by it and some people aren't. And when you're experiencing chronic pain, the most important thing to understand is you have to address it. A lot of times over-the-counter things like Aleve and Tylenol, they help to mask some of these symptoms and make us think that we're feeling better when we're really not. Nerve and joint conditions do not get better on their own. They can heal to an extent, but they will eventually start to take the toll on people, and people start to notice that they're losing function, movement patterns, issues with lifting and bending. Sometimes they're experiencing nerve pain or having balance issues, and that's something I want to help address with our patients.
That's right. Can you tell us about your new treatment program?
Yeah, so we are a research-based clinic. That means we're always studying the most advanced medicine that you could possibly use in the world. We've teamed up with several different research institutes, and one of them is the International Institute for Chronic Disease. And this is an organization that we've been working with for about 4 or 5 years now that has developed very specific protocols for people. So when you're experiencing joint and nerve pain, the biggest thing is customized care. We want to know if you have a problem with your neck or back. Is it affecting your shoulder or your leg? Are you having balance issues? And we've been able to customize very specific protocols to legitimately work on almost any disc or nerve condition that somebody has. So if you have stenosis, we can treat it. If you have sciatica or peripheral neuropathy, we can treat it. And we can rehab that to a level that conventional and alternative therapies can't do.
And how is that helping people eliminate pain?
So the biggest thing about eliminating pain is you have to get to the root cause. I had a consultation that came in the other day, and they were constantly looking at his hip and his knee pain. They didn't have massive degeneration in the knee. He didn't need a hip replacement. And the doctors seemed kind of baffled as to what was going on. I looked at his MRIs. He has spinal stenosis and a disc herniation at L4 and L5. Well, guess what? Those nerve roots control the leg and the foot. So we're all about getting to the root cause of the pain, rehabbing that condition, then rehabbing everything you've been going through. So we use a series of treatments, and the patients typically, a lot of them call it a spa. It's very relaxing, but we're doing 2 to 3, even 4 therapies a visit, and we're hitting all the attributes to your pain.
How did you develop that protocol?
So this is something I've been studying since I was in college. My grandmother had rheumatoid arthritis and was basically living off of pain medications and injections until she got osteoporosis. And I just started questioning the standardization of how we treat our patients, especially senior citizens or people with nerve and joint disorders. And what I simply found was there were thousands and thousands of research articles that had very specific treatments that worked. So I started studying these things, developed my protocol, brought everything into one environment, and started my practice about 8 years ago. And we've really had some serious clinical success in helping any array of patient, age, even multiple surgeries. We've been able to give them their lives back.
What kinds of conditions can you treat with that?
So like I was saying earlier, anything related to the spinal cord, to the musculoskeletal system, arthritis, joint degeneration, spinal stenosis, sciatica, neuropathy, balance issues, we can rehab anything related to an effect from the disc or the joint, the nerve, the muscle, or its blood supply to that area. So if it's attached to the bone, muscle, or joint, we can fix it.
Now, what has been your success rate with your treatments?
So medicine's not perfect, okay? I'm a very honest and upfront person. We have about a 95% success rate. 5% of my patients don't do very well. Those 5%, though, I'm very honest. These are people that came in at a really bad time. They're I don't want to say addicted, but they're on many, many different types of pain medications. They have stimulators in their body, which we've had patients on here before where we've still been able to help them. But I like to be very honest and upfront. I'm not going to guarantee 100% every time, but more than 95% of our patients come in and have a significant amount of pain relief, more than 90% with functional improvement, and we can assess for it. It's not just, hey, how are you feeling? Oh, you're feeling good? You look good to me. We have ways we can actually assess how a damaged nerve heals, and we can prove it through clinical research.
Let's talk about your free consultations and upcoming Lunch and Learn seminars.
Yeah, so I always offer free consultations. It's an opportunity for you to come in and talk about your problems one-on-one. If you're a little cautious and you want to learn more and you really want to see what we're all about, we do a Lunch and Learn seminar every third Wednesday of the month. We have about 25, 30 people. You do have to reserve, but you'll come in, you're going to learn about nerve and joint disorders, pain medication, what it really does to our body, the side effects of some of the risks that we might take, and then you're going to learn about advanced medicine like what we do in the clinic and how you can safely help these conditions heal without any negative side effects.
Beautiful. Is there anything you want someone to know if they're thinking about coming in to see you?
Know that you have a doctor that really cares about you. Don't be afraid. You know, I've had personal problems where I've injured myself. Do not wait. Come in, have a conversation. It's the least you can do. Call us at 650-PAIN. Go to buffalopainrelief.com. Take our pain questionnaire. Learn about us. Take a look at the testimonials of the people we've treated, and you'll really see that these are people that felt like you did right now, and they have their life back.
Alrighty, Dr. Miliotto, thank you so much for coming in.
Pleasure.
Viewers, for more information on our sponsors at Western New York Pain Relief and their upcoming Lunch and Learn seminar, just visit buffalopainrelief.com or call that number right there on your screen.